Welcome to a new season with a new set of the Navigating Your Life show. Tonight we're going to be discussing ways to navigate through the medical maze. There's a lot to understand, from how to choose the right insurance carrier to how to choose the right physician. To help us, we had the opportunity to visit with the Lehigh Valley Health Network with Dr. Debbie Salas-Lopez, who's the chair of the Department of Medicine, to discuss changes in healthcare. And here's what unfolded. So thank you, Dr. Debbie Salas-Lopez, for joining us.
It's nice to meet you.
Good. You are the chair here at the Department of Medicine. Tell us a little bit about your background and also what you do here.
Sure. So I'm the chairman of medicine at Lehigh Valley Health Network. And I'm also a professor of medicine with our new affiliation with the University of South Florida Medical School Branch campus that we have now here at Lehigh Valley Health Network. And I'm also the Associate Chief Medical Officer for the network.
We wanted to talk with you as we're trying to help people understand how to navigate the medical maze. We wanted to talk about healthcare reform. So could you highlight some of the changes that people can expect once that goes into effect?
Sure. So one of the things that healthcare reform does, I believe, for our community is to provide access to care. We will have approximately 32 million people newly insured who will have access to healthcare who didn't have access before.
So these people are uninsured now.
That is correct.
And they'll be entitled to be insured.
That is correct.
And is there a date that has been set for their entrance?
The projected date is 2013 for this, but as you know, it can be a moving target. The other parts of the healthcare reform is that it does provide for primary care physicians access to care, coordinated care. Which in the past we hadn't focused on. So it does allow for people to have a primary care doctor. And in the healthcare reform law, they call it patient-centered medical homes. But what it means is that people will have a medical practice that they can call their home, where their physician and their healthcare team will know everything there is to know about them and will help them, in fact, not only coordinate care, but also help them navigate through the healthcare system and link them to the different things in the healthcare system that they'll need.
Right. And I would assume that a lot of these 32 million individuals are coming through the emergency room, and I would believe that part of this healthcare reform is to say, don't go there. The primary care physician is the place to go as an entrance, as long as it's not an emergency, but that's where you would go. Am I correct in understanding?
You're absolutely correct. What this does is, if you now have insurance, in the past you used the emergency room as your primary care doctor, and in fact you waited until late stages of illness to come and present yourself because you knew that there was a high cost, you had to wait long hours in the emergency room to be seen. So this does something very different. It links you to a physician and to a practice where you'll be known to them. You'll be able to get care in a proactive manner and not wait to get sick. So we're going to switch the system, hopefully, with healthcare reform from a sick healthcare system to a healthy healthcare system.
And just give me an example. I know every patient is different, but where you may see that a person should really be going to a primary care as opposed to the emergency room, if you can just share with me one or two situations.
Sure. So you shouldn't come to an emergency room for routine immunizations, right? Those are the kinds of things that your physician, your primary care physician, can be taking care of. An upper respiratory infection, a sore throat. Those are the kinds of things that your primary care physician can easily take care of. And those are sometimes the things that we see in our emergency room. It's unfortunate that patients feel like they have to come into an emergency room to get that level of care.
And you can't say you're not going to be served. You're going to serve them.
We never turn anybody away, right?
They may just have to wait because there are other patients that are more higher in need than they are. Wow. So when you look at healthcare reform, other things besides the primary care physician, what else is healthcare reform bringing? Because it seemed to get a lot of interest by people, like there was something wrong with it. But what you've described so far, I don't know who could object to that. But are there other parts that?
Yeah, there are a lot of unknowns with healthcare reform because healthcare reform didn't give us payment reform, right? So we have to figure that part out. I think what it does do is it stipulates that you have to maintain or improve, right? You have to provide great quality health care to our community, but you have to do it at a lower cost because the costs now in healthcare become pretty prohibitive. And the other thing is that it's got to be timely. It's got to be there when you need it. And so, and lastly, that we have to have the infrastructure using technology to make sure that no matter where you go to a healthcare system, your health information is available so that physicians can make informed decisions
in a timely fashion.
In a timely manner. That's right.
What else would you like to share with our viewers as they consider navigating the medical maze and doing it correctly and appropriately? What other advice would you like to share with them?
When you go to the doctor's office, first of all, know the name of your physician, of your primary care physician. And if you don't have one, call 402-CARE. We'll get you one, right? So that's number one. Have a primary care physician. The other is that when you go see your doctor, be prepared with a list of questions and things that you want him or her to address with you.
And just stop there for a second. I think that that's so critical. I have an aunt who's 81, and she's always writing down stuff, and I keep, what do you write? But the reality is she goes in and she goes down that list.
Boom, boom, boom.
And the doctor appreciates that. And the doctor sometimes will take it out of her hand and say, hey, what's on the list?
That's right.
Wow, so that's a very good point. So be prepared.
Be prepared with a list of questions and things you want the doctor to address, because remember, it's a 15-minute, 20-minute visit. That's a very short time, and while we're sitting there, we forget all of the things that are on our minds. Wow. And that includes technology, right? You can email your doctor,
That's true.
right?
That's right.
You can call your doctor and talk to the care coordinator, the nurse, right? Or you can even get on the internet before you go to the doctor's office. Look a little bit up about what you think you have, and come prepared to have a discussion with the doctor about that.
That can also be very dangerous, because I can see a person coming in with a whole list.
They do.
They went to their own medical school.
But doctors like informed patients.
Okay.
And so do the healthcare team likes informed patients. So for the most part, I think it's okay.
Good. Well, thank you, Dr. Salas Lopez, for sharing some time with us today. And Lehigh Valley Health Network is very lucky to have you as part of their staff.
Thank you very much. It was a pleasure being here.
Good. We're now going to take a short break. When we come back, we'll be with a representative of United Healthcare. So please stay with us.
Do you have a community event or a special person you'd love to spread the word about? How does reaching a potential audience of 2 million viewers sound? Announce a conference, festival, fundraiser, special event, or even nominate someone in your community who's making a difference. Send us the information to include in our weekly community spotlight to the email listed below before space runs out. All events must take place between mid-September and mid-December.
Enrich your life at Sacred Heart Villa, situated atop Mount St. Michael on 40-plus scenic acres. Our caring staff includes missionary sisters and on-site licensed nurses 24/7. We offer medical reminders as well as dispensing medication and transportation to medical appointments. With excellent food, fun events, a spacious hall, safe rooms, and much more, your life will be enriched. Call 610-929-5751 or go to sacredheartvilla-readingpa.org.
Ready for some fun? FunWorks assists individuals with and without disabilities to participate in community activities. These activities are provided in small settings for 1 to 8 individuals with at least 1 to 2 direct support professionals. We visit places like Dollywood, Willow Valley Inn, Phillies Games, Iron Pigs Games, the Lehigh Valley Zoo, and more. Let us know your dream trip. Our staff is dedicated to ensuring your dream activities come true. For more information, call 888-966-9466 or visit funworksinc.org.
So we're back, and we're now going to be talking with Michelle Golia of United Healthcare. She's the Director of Small Business Sales. So welcome, Michelle.
Thank you.
Good. So what is it that you do for United Healthcare?
I am the Director of Small Business Sales and Account Management. I have a team that sells to businesses that have 2 to 99 employees through our broker channel.
Wow. And we wanted to pick your brain today about some of the choices that people have when they're signing up for healthcare. And one of the things that has always baffled me is, what is the difference between an HMO and a PPO and any of the other varieties that are offered to employees when they're signing up?
Great question. This time of year, employers hold their open enrollment sessions. And I think I just want to take a minute to define open enrollment and why it's so important to employees. They really need to pay attention to the benefits that are being offered to them, because at open enrollment, you're making your benefit selections for the entire plan year. It's a great opportunity for the employees to add dependents, delete dependents, make a new plan selection if there's one being offered, and then to navigate through. Do I want an HMO for me and my family? Is a PPO better?
So it's like a window that is opened up once a year for you to decide which plan you want to be in.
Absolutely.
And then a lot of plans, that's the only window. So if you miss the window, you have to wait for the next year.
That's right. You're locked in for the whole year. So it's really important not to just go in and say, I want the same plan I had last year and just check a box and move on. There's always different options out there. And HMO, it's a health maintenance organization. It's an in-network only plan. So you have to utilize the physicians and hospitals that participate in that specific carrier's network.
So that book that they give you of all the listed
Correct.
Providers, you need to stay within that book.
Right.
Okay.
And nowadays, everything's online. So we really encourage members to go to their health plan's website and look up their specific physicians to make sure that they participate in the network, especially if they're going to be selecting an HMO.
Okay.
The HMO does require that you select a primary care physician and that you get referrals to see specialists.
Okay. From that primary.
That's right,
Okay.
exactly. So if you go to your primary care physician and he says you need to see a cardiologist, he's going to write a referral and you're going to go see a cardiologist that participates within that specific
also-
physician network.
And that cardiologist will also be in that book.
That's exactly right.
Okay.
So for those services under the HMO, you're going to pay a copay for services. That's a fixed dollar amount that you pay. So you know when you go to that cardiologist that your copay is $50. You go into the doctor, you pay $50, you move along.
Okay.
So it's less flexible, but it's usually least expensive.
Okay. So that's a health maintenance organization, and you mentioned the other one, which is a PPO.
Right. Now the PPO allows for more flexibility. The PPO offers
What do those letters stand for?
Preferred Provider Organization.
Okay.
Right. It's not as complicated as we make it. If you really break it down, Preferred Provider Organization just means that you have preferred providers that you can access that participate in network, but you also have access to out-of-network providers as well.
Okay.
So under the PPO arrangement, you may have copays or maybe a minimum deductible, and I'll explain what a deductible is in a minute.
Sure.
But as long as you stay within that preferred provider network, your out-of-pocket cost when you get services is going to be less.
Okay.
But it does allow for out-of-network. Right. So if there is a physician that you've been seeing since you were a child, there's no way you're going to change that physician. You can do so under the PPO, but you're going to pay more out of your pocket for those services.
And just offering some advice, people trying to choose the right doctor or right medical facility, what are some of the criteria that you suggest to them as they're trying to navigate the system? How do you decide what's good?
Yeah, at United Healthcare, we have a premium network where it's all of our physicians are rated on quality first and then second on affordability. So there are physicians and hospitals that can have 1 star where they have passed our quality standards, and then a physician or hospital that has 2 stars has passed quality and affordability. So this is really a great guide for our members and for people to look for a physician that has passed that affordability and quality so that they can, make the better decisions, because those physicians can get better or give better care, better quality of care, but it's going to be less expensive for them.
Wow. And before we get ready to wrap up, you wanted to talk about deductibles. So share with us what a deductible is.
Sure. A deductible is a dollar amount that you have to meet before your benefits kick in.
Okay.
So, for example, you may have a $500 deductible. That $500 deductible has to be met before any part of the plan starts to pay.
So you have to pay that first.
That's
and
correct.
And is it $500 per person? Let's say you're a family of 4.
The way that it works is typically there's a single deductible of $500, a family deductible of $1,000. So one person would satisfy the $500 deductible, and then the entire family would make up a $1,000 deductible.
And so you have a payroll deduction, you may have a deductible, and you may have a copay.
Right. The difference between a deductible and a copay is something every time you receive services, you go into the doctor, I'm going to see a cardiologist, I have a $50 copay. You pay your $50 copay, you leave the doctor's office. When you have a deductible, you don't pay anything at the time of service. The doctor's office files the claim, we process the claim, and we apply the provider discounts, because remember, we talked about staying within that physician network. We negotiate our fee for service with that doctor. So now you want to take advantage of the negotiated discount amount that we have in place with that physician. you're going to get an explanation of benefits that says you went to the doctor and you satisfied $100 of your $500 annual deductible.
Okay.
Then you owe the physician $100. And now you've satisfied $100 towards your annual deductible. Where a copay, you pay the copay every time you go to see that physician.
Regardless of whether you've met your deductible or not.
Exactly.
Okay, very good. As we get ready to wrap up, Michelle, is there anything else that you want to share with our viewers as some hints or information that would help them?
People need to take a look and see what else is being offered to them. We offer discounts on joining gyms, things that aren't typically covered under your medical plan, like massage therapy, acupuncture, smoking cessation products and classes. So if you want to quit smoking, we have discounts on how to do that. If you're interested in losing weight, we have an online wellness coaching program that you can participate in. It's a 5-week program designed to help you lose weight, and it's free, and it's all part of your benefits program. So that is one thing I would really urge the viewers to do when they're at their open enrollment meetings. Ask questions. Ask about the bells and whistles that come along with their programs outside of, you know, what's my copay, what's my deductible, but what else am I really getting here through my benefits program?
Because I guess if you have a lucky situation, you may never use your health care, but you may want to use some of the other things that go along with it. You know, the gym or some of the other things that you mentioned, you may have a use for those, and you're already paying for it.
Right, you're already paying for your health insurance, and if you don't use it, you have all of these other great avenues that you can take advantage of, and it's so important, you know, especially for wellness and fitness, and all of those programs are available to you. Why not take advantage of them?
Wow. Well, Michelle, thank you so much for joining us.
Thank you so much.
A wealth of information.
Thank you.
We'll now take a break. When we come back, we'll be talking with a representative of a business coalition concentrating on healthcare. So please stay with us. Explore Dr. Nat Williams' Absolutes of Success book series featuring The Navigator of Life, The Mature 64, Living Life 8x8, Management and Leadership by the 3 Ps, The Affordability Factor, The 4 Cs of Change, Embracing Your Real Life, and the Absolutes of Success series workbook, Maximizing Your Greatest Potential to Achieve Your Personal Best. All books available at drnatwilliams.com or amazon.com.
Do you want to achieve your personal best? Then join Dr. Nat Williams for the Absolutes of Success series Attaining Your Personal Best workshop in Bethlehem, Pennsylvania on either Saturday, September 11th or 25th from 9 to 5. Workshop highlights include a better understanding of challenging life events, life's least common denominators, reframing, and developing a solid plan for the future. Register today, only $50, which includes the Absolutes of Success series workbook. See you there.
So we're back with Mike Donio, who's the program manager for the Lehigh Valley Business Coalition for Healthcare. So welcome, Mike.
Thank you, Nat. My pleasure to be joining you and your viewers this evening.
Thanks so much. You said that the coalition has been around for 30 years. Give us a little bit of the history.
Okay. About 30 years ago, some of the larger employers in the Lehigh Valley were looking at what it was costing to provide medical benefits to their employees. And they looked at the situation and they said, well, you know, we buy a lot of raw materials that we use in our businesses.
Sure.
So why can't we begin to purchase medical goods and services much the same way? So out of that initiative came the Lehigh Valley Business Conference on Healthcare. A few years back, we changed the name to be more reflective of the fact that it's now a multi-state purchasers coalition.
Wow.
We have partner vendors for medical, dental, prescription, vision, managed care and employee assistance programs.
So how does the arrangement work?
We already have partner vendors
Okay.
for those products, and if a company is interested, they could contact us and we can give them information on membership.
Wow.
We have a website where they can get a lot of information about the types of programs we have available. I want to also say that we work with the broker community, and they have clients and they look at some of the programs that we have and see whether or not it matches the needs of those particular employers.
Wow.
We have employers from anywhere from 2 to 18,000 employees, so we cover a broad range. And one of the things that we do is we use our critical mass to drive better rates, because the object is to have affordable and cost-effective health care. But the coalition is also emphasizing quality of care. And that means that we want to avoid never events. We want to have someone go to the facilities that provide the best care.
When you say never events, what do you mean by that?
Okay, a never event is defined as something that should not happen during a procedure.
Okay.
A retractor left inside a body cavity, accidentally nicking a ureter when doing abdominal surgery. And these are things that are defined as things that should be avoided.
Wow.
There's a national organization known as the National Quality Forum, and they have set out this list of never events. It has also been adopted by the Centers for Medicare and Medicaid Services, CMS. And it's a way of saying, let's improve the quality.
Now, if I was a company with 2 people, am I going to get the same rate as a company that has 2 than one of your companies that has 18,000 employees? What would my rate look like?
Well, there's a difference. For the self-insured companies, we're dealing with a larger mass. Now, we do have a new program for smaller employers, anywhere from 2 up to about 200. And that is a partnership we formed with Health America and the Lehigh Valley Health Network.
Wow, okay.
And it has been very successful. It has been able to expand our membership. We have about 175 member companies. And as I mentioned, we are multi-state, so we have employees in New Jersey and Virginia, North Carolina, Texas, Florida, California, and even Montana. So the company could contact us directly. If they do have a broker, contact their broker as well. And we can get the information to them.
What are some of the suggestions you give for a person choosing a primary?
Well, I sort of have to go to the end to work back. And I think one of the things that you need to do as a consumer is, what is your insurance coverage? Who is in your plan? You want to pick a physician who is in your network. So that's a good place to start. Then you'll probably get a booklet that lists all the different participating providers. And if you're looking for primary care, you can start asking some of your friends, some of your neighbors. You can even call some of the hospitals because they have physician referrals. So you start getting a list of practitioners. Then one thing we used to recommend when I was with the consumer group is that you have a get acquainted visit where you call the physician.
No agenda.
No
just
agenda.
coming in to say hello.
Just come in to say hello.
Now just stop for a second.
Yes.
How many doctor's offices are going to make time in the schedule for a person that's going to just call up and say, I have nothing wrong with me, I just want to come in and say hello?
Well, what you do is you explain that you are choosing a new primary care physician, and you would just like a few minutes of the doctor's time to discuss, what your concerns are about how you are interacting, because in a very essential aspect of healthcare is that you and your provider are really partners. And the better partnership you have, the more communication, the better care you're going to get. So the first thing is you want to get your list. But you also need to look at a physician's credentials, and one of the best ways is looking at who is board certified.
What does that mean, board certified?
Well, board certified means that if you and I went to medical school and we graduated, that very day we could hang out a shingle that said, practice limited to brain surgery. Now, of course, no one does that. The object of becoming certified is that a physician can specialize in a particular area. And there is an organization known as the American Board of Medical Specialties, and they issue certifications to physicians who have completed adequate education, generally a residency, and they must also pass a certifying examination. The one area that you might want to check, and this is only because it happened in some areas, a physician might be board certified, we'll say in internal medicine, but they might have a sign below that. It says practiced limited to, but it might not be related to that. So they could be board certified in a specialty, but they could limit their practices to something else in which they're not board certified. So you want to clarify that. There's also the issue of a physician who could be board eligible. And that you want to make that very clear. But
what is board eligible?
That just means that the person has probably completed the residency but hasn't taken the certifying exam, but they are eligible. Generally, most of your major medical facilities, while there is no law that says that a physician must be board certified, they generally encourage that because you can practice better medicine and get a better outcome, and that's what we're really all about.
Good. As we get ready to wrap up, Mike, is there anything else you want to share with our viewers?
Well, I'd like to say that if you want to check on a physician's credentials, go to the website www.abms.org, and you can see a list of all the different specialties there. I think you can plug in a name. The state of Pennsylvania also has some information available on physicians. Go to the State Board of Medical Licensure and follow the steps, and that will get you information.
Well, Mike, thank you so much for all the information.
My pleasure joining you and your viewers.
Thank you so much.
Thank you.
We're now going to take a break. When we come back, we're going to wrap up today's show, so please stay with us.
At Bridge to Creative Learning and Child Care Center, your child will learn and play the creative way in a safe and secure environment. We offer a fun and caring educational-based atmosphere and allow parents to monitor their child's activities. We are a state-licensed child care center offering academic preparation, after-school programs, creative learning, summer activities, and much more. Call us at 610-351-7400. Prepare your child for a brighter future.
It's about changing the world in which we live.
It's about playing, living, and working together.
It's about escaping from special programs.
It's about finding leadership
and social justice.
The Pennsylvania Developmental Disabilities Council believes that disability is a natural part of the human condition.
We are working to create a commonwealth where all people thrive in shared citizenship.
And everybody wins.
Next week's show is going to be concentrating on common household fixes for that wonderful place that we call home. So we look forward to having you join us again next week. Thank you for watching today.
A list of resources related to today's show is available on our website, which is navigatingyourlifeshow.com. On this site, there is a connection to our Facebook and Twitter pages and to our blog. While you are there, you can also email your comments on today's show or share ideas for future shows.